Hi, Kevin Henry at Dental Economics, here today at the Speaking Consulting Network meeting in Charleston, South Carolina. My friend Uchi Odiatu, and we're going to talk today about fitness. And fitness is something that Uchi and I were just talking a little bit about off camera, and it's a little bit misunderstood, honestly, in your opinion.
Oh, for sure. Most people think of getting in shape and getting a flat stomach and looking great is about having a better Facebook picture profile, or how to look amazing for the high school reunion, or the college reunion, or the dental school class reunion. And my big power and push when I talk to audiences is that it's so much more than just looking hot. Sure, it might attract a better mate, or you might make yourself, have less anxiety in social situations. But it's amazing how the new research on how it affects the brain, there's a thing called BDNF, brain-derived neurotrophic factor. And John Rattay, he's a Harvard-trained psychiatrist, said that people of equal ability, someone who's just as skilled IQ-wise, just as skilled maybe in the dental team, the person who exercises will always outperform the non-exerciser, all things held equal. So it's really hard in life to improve your IQ once you get to a certain age. But if dentists and the dental team and the hygienist, the receptionist, could realize the value of physical fitness to enhance almost everything they do. I firmly believe, like JFK said, when the tide comes in, all ships rise together.
So if somebody's watching this, I don't have time to exercise, my schedule's so busy, when do I fit this in? What's your suggestion on a good way to at least get started?
Yeah, and that's a big excuse. I don't consider that a powerful reason. Sometimes the busiest people, that whole saying, if you want something done, ask a busy person. And I said exercise can be condensed into 10-minute increments.
Okay.
This is from Dr. Oz. I met him a few months ago in Toronto. He said most people think, especially male dentists, they think fitness is all about an all-or-nothing phenomenon. And the whole idea is you sneak it 10 minutes away. And people think, how can you get a workout in 10 minutes? Keep your dress shoes on, keep your pants on. So, don't have to put shorts on, you can wear a t-shirt. Put a stationary bike in your living room. And they go, that is not going to go with my chandeliers. Who cares, You want it to look, you want to feel good. So the whole idea is you get the stationary bike in front of your TV. You get an old journal, one that you haven't read. Most of us have a sea of journals lying around. Take a journal article that you want to read, get on your stationary bike, start pedaling. The cool thing about that is many times it takes about a good 10 minutes to read one article. Okay. And when you're moving the pedals at the same time, you have increased oxygen to your brain. What happens when you're actually holding something in your hands, when you're doing any kind of cardiovascular work, it means you have to balance more. So in that 10-minute little snippet of workout, you get some core training. At the same time, you're getting left-right brain training because your mind is focusing on the article even more so. And the 10 minutes flies by. You barely break a sweat, you put the article down, you think, wow, that was easy. And you make a check mark off. If that's the only thing you do that day, I always say forget the hour every day and looking great by Labor Day. If you can do 10 minutes a day till you're 100, you'll be well on your way to enjoying a full, fit lifestyle. So forget the 1 hour a day, the personal trainer for upper body and lower body. It's about that 10-minute little snippet of increments. And you could fit another 10 if you want to, but I say 10 minutes is a great place to start and celebrate that first little step forward.
So is it as much about getting the heart rate up as much as it is just getting off the blocks and getting started on a 10-minute regimen like you're talking about?
Good question. There's so many things to consider if you want a complete exercise program. There's balance training, cardiovascular training, strength training. And some people get mixed up in the minutiae. They talk about coenzyme Q10 and how about glycemic index of foods. Dr. Andrew Weil said you can probably lower the healthcare costs of Americans by 25% simply by going out for a walk 3 times a week for 30 minutes. You don't have to know about coenzyme Q10 and the glycemic effect of food. Just start moving, and enjoying the increased endorphins and dissipating stress. I mean, there's all kinds of talk now of how stress is 90% of all chronic disease. You think of arthritis. 50 million Americans suffer from arthritis. Not just the knee and hip joint, TMJ joint. And all these dentists will making splints for patients, not talking about the wellness milieu of the whole discussion. So in my practice, and I have one talk called How to Develop a Wellness Center Practice, I say when you mention things outside of the mouth, which patients are pleasantly surprised, because no one has time to talk about their whole body, even their medical doctors. So when you ask about your hydration level, because synovial fluid in the joint is 85% water. You ask patients about how they slept last night. You're like, Doc, what does that got to do with my mouth? Well, if you actually have a night of disrupted sleep, your immune system's working at 50% the next day. And you got to think, well, maybe I shouldn't be doing a full mouth clearance and extractions on you today because you're a shift worker and you only had 3 hours sleep last night. And you bring different components to your treatment planning, to bring different questions to the new patient exam. People start thinking, wow, I'm in a different kind of dental office. Your schedule gets booked beyond belief, and you realize I'm on the right track, and you still don't know how to spell coenzyme Q10. So the whole idea is falling forward and celebrating easy 10-minute increments of movement.
Okay.
Yeah.
Uchi, how can our viewers get a hold of you if they want more information?
Well, my website is fitdentist.com. Okay. So fitdentist.com. I have 2 books. My wife and I, we co-wrote them. One is called Fit for the Love of It. The second is called The Miracle of Health. They're available on Amazon.com, obviously. They can order them through their bookstore, Barnes & Noble, if they like. I love getting questions from all over the world, and I am passionate about taking people and helping them get to the next level in their health and fitness, and really becoming inspired to see their old, stale, worn-out fitness dreams become a reality.
Sounds good. Thanks for the time.
Yeah,
I really
thank
appreciate
you.
it.